At the Health Data Hub, we are very proud and excited to launch this SHAPE project that we believe will be really a key initiative for Europe to, one, reinforce the ambition of building a European health data space, and two, to really enhance the development of AI for health in Europe to stay competitive and also to accelerate the innovation to the patients. So to do that, we are now gathering 30 partners across 11 countries to really bring different perspectives, different expertise to define how the European health data space can really support the development, the testing, the access to the market of AI-based medical devices.
SHAPE is a very ambitious project, and both DG Connect and DG Santé, we have high expectations from this project. First and foremost, we want to see not whether the European health data space can be used for AI, but how will the European health data space and the Health Data at EU infrastructure will be used for AI development, validation and deployment of AI tools in healthcare. We look forward to see the lessons learned and recommendations from SHAPE to the health data access bodies on what services they would need to provide to researchers. Then, SHAPE is the first pilot project that will show concrete interaction between Health Data at EU and research infrastructures and ethics. They will leverage the existing services for AI.
And we are leading a work package dedicated to AI as a medical device. We are going to look through 4 tasks to the possibilities given by the Open Health Data Space regulation, the HDS, how we can use this framework to enable or facilitate the development of AI as a medical device.
Work Package 4 of the SHAPE project, led by THL in Finland and together with Charité in Germany and Ajax in Spain, will focus on ensuring that real-world data bottlenecks in the process of certifying AI technologies for healthcare as medical devices are addressed in a more efficient way. We are going to try to focus on improving deployment through certification processes, regulatory monitoring, and use of real-world data for reimbursement and pricing. We want to ensure that these technologies get implemented while at the same time we ensure that they are safe, beneficial, and ethically used in the healthcare settings.
So it is very important to have some concrete use cases to support the work of SHAPE, to talk about concrete things. So we have 3 use cases, and today I'm going to talk about one of them, which is about the evaluation of medical devices involving AI, and it will be about oncology, so about breast and lung cancer. So the goal is to evaluate this medical device for certification purposes or for deployment in hospitals. So for that, we have the use case leader, which is the Centre Léon Bérard, a French hospital, that will help in collecting data in France, Spain, Italy, and Holland. And of course, we are also supported by EUCAIM, the European Infrastructure for Research on Cancer. So of course, we onboarded also with us 2 French startups specialists in medical device for oncology. One of them is TheraPanacea and the other one is TheraPixel.
As a startup in the breast cancer space, TheraPixel is really excited to work with SHAPE to develop a representative and non-biased data set to help evaluate medical devices based on AI for hospitals and clinics that are sometimes hesitant and sometimes working in the unknown.